name is Sean Stanislaw. I'm a physical therapist with CPRS Physical Therapy. In this video I'm going to show you a couple exercises for SI pain dysfunction. First exercise we're going to show is a piriformis stretch. Jeremy, we're going to say, has right-sided pain. So the first stretch with this, he's just going to cross over. Now because the piriformis is on the back side of the buttocks, this might be enough if he's really tight that he feels a stretch. Okay? And any stretch you're going to hold at a minimum of 20 to 30 seconds, and you can hold a little bit longer than that if you're not quite feeling it. Alright? A progression would be just bending this knee. You can see that puts his hip in a little bit more flexion. That's going to stretch that muscle even a little more. Okay? Again, you can hold about the same duration as the one before. And if this still isn't enough stretch, if you're not quite feeling it, you can have reach through, there you go, wrapping behind the thigh, and this is really going to stretch that muscle. Okay? So you don't want to jump right to this one. You're going to want to start with the easier progressions, and if you don't feel the strong pull with the other ones, you go to the stronger progression. Okay? Okay, the next exercise is going to be an abdominal brace with marching. With this exercise, we're going to be working some of the deep core muscles that attach directly to the spine and to the pelvis itself. What Jeremy's going to do here, he's going to flatten his back out just slightly, okay? And then he's going to tighten up the muscles so that he's almost drawing his belly button down a little bit towards his spine, just trying to get everything tight. And he can even use his hands, his fingertips, right in his lower abdominals, just so he can use that as kind of a lie detector, see if he's actually squeezing the muscles or not. Once you have that down, and that's key, you have to have this down first. Once you do, we're going to start adding a little bit of movement. So what we're going to do with this exercise is just a march. And it's going to be alternating. He's just going to lift one foot off the table just slightly, and then back down, and alternating in a marching pattern. Now with this, as he's marching, he's maintaining that squeeze of his abdominals. So this is teaching your core that you need to be able to stay tight with your core and still allow movement. With this exercise, you'll do about 10 marching steps. That'll make up one set, and repeat that 2 to 3 times. So the last exercise I'm going to show you in this video is going to be a quadruped alternating arm leg extension. Okay? Jeremy's going to go onto his hands and knees, hands right underneath the shoulders, knees right underneath the hips, keeping a nice neutral spine during this. And he's going to slowly and controlled extend his right arm and left leg, making sure that he keeps his shoulders and his hips level. Okay, you hold it for about 5 seconds, do 10 repetitions on each side, and you can repeat that 2 to 3 times. And you want to watch, make sure that the hip doesn't drop, and again, you're keeping your abdominal muscles nice and tight throughout so that your low back doesn't sag.